Hi,
Hi.
I'm Dr. Ritchie. I'm one of the doctors on the ward.
Can you tell me what's happening?
Of course I can. Before we talk things through, can I just double check who you are?
Well, I've come in with my husband, Mr. Thompson.
Okay.
John Thompson.
And am I right in thinking that you're his wife?
Yeah.
Okay. Is there anyone else with you today?
No,
or anyone you'd like with you?
We were just out shopping.
Okay. And as I understand things, he's collapsed in front of you.
Yeah, he just suddenly said, "Oh, I've got a dreadful headache that's just come on like that," and the next thing was he was on the floor.
Okay. Must have been quite shocking, that.
Well, yes. And somebody called an ambulance and
they brought
here
him
we
here.
are, yeah.
And
I know he was taken to intensive care, but I don't know what's happening.
Okay. Has anybody told you what's caused the collapse or anything beyond the fact that he's on intensive care now?
When he came in, they said it might be a bleed, but I don't know if it is.
Okay. They've done the scans, and I think that initial suspicion is confirmed now. He's had a bleeding episode on the brain, a large one, which is what's caused him to have the headache and to collapse and to be so unwell at the moment.
So what can you do with that? Do you operate? Or?
Surgery is one of the options in this scenario, and it's important to get the views of a surgeon.
Mm-hmm.
Now, we've spoken and reviewed both your husband and all of the scans with the neurosurgeons, the brain surgeons who would think about doing this sort of operation. Now, after looking at everything in detail and relating it to how your husband is, they don't believe that doing an operation is going to help him.
So he'll just improve without. Will it affect him long term?
Well, I think he was phenomenally unwell when he was brought in. I mean, you saw the fact that he was unconscious. Now, while we've been doing all of the investigations, we've been giving him lots of treatments to try and help stabilise him, in part to allow us to do the tests, to try and find out what's going on, and in part to try and buy us some time to see if there is anything that the surgeons can do. Now, he has stabilised enough that we're able to do those tests, but for something like this, the only treatment option is surgery. And as we've mentioned, the surgeons don't believe that that's possible. They don't believe it would help him in any way. Now, while this has been going on, we've been doing our best to try and keep him stable, to keep his circulation going, and we've been having to help him breathe for himself with a machine. And that's the reason that he's been moved to the intensive care unit. That's why this can be done. However, despite this and despite all of our best efforts, things actually are not improving. And he is, if anything, slowly deteriorating. He's getting worse. When this happens...
I can't believe this. I mean, 2 hours ago he was fine.
Yeah. I can't imagine what sort of a shock this is.
It's impossible to take in, really.
Yeah.
It's unreal.
It's a sort of shock that I can't imagine having. I mean, do you want to have a little moment to pause? Do you want to break in the conversation, or to get a friend or a family member to come in with you?
No, it's all right, carry on.
Okay. When someone's so unwell, we have to think about how we can best help them. And what we would always want is to try and find a way to cure them, to get them better. And as we mentioned, the only option here is surgery, and the surgeons do not believe that that is possible. When you can't treat something, you then have to think about what's going to happen and how else we can help someone be comfortable. With a bleed of this size, I think we would not expect your husband to survive this. I'm sorry to say that in such blunt terms, but I don't want to be uncertain about how serious this is. What we'll do in the interim is we'll do our very best to keep him stable. But I think what we need to think about doing is making sure that with this bleeding, there isn't any ongoing discomfort. You mentioned he had a very severe headache. So although he is unconscious, we've got to think about things that may be making him in some way uncomfortable or distressing him at all. Now, he's sedated at the moment, so he's not going to be feeling any pain or distress, but we want to ensure that persists. Is there anything you want to ask about that?
No, I mean, it sounds the right thing to do, really, doesn't it?
Okay. Now, as I understand things, the intensive care consultants have discussed with you the fact that they don't believe he's going to survive either. And if I'm informed correctly, what they've suggested is that if they don't believe he's going to survive, they want to make sure that he's, in essence, as comfortable and dignified as possible, and they'd want to remove him from the ventilator that's helping him breathe at the moment.
No.
Is
You've already said that he's deteriorating and he's sedated, so he won't feel anything. Just let him go naturally.
Okay. What we do is we certainly want to keep him comfortable, pain-free and sedated. However, what we have to consider is what you've just said. We want someone to, if they're not going to survive, we want them to have as dignified and as natural a death as possible. And with a ventilator in place, it's artificially sustaining life. It's not helping him survive, it's simply keeping things going. So with that in place, in essence, he won't be able to have a natural death, which is why they've suggested that it would be appropriate to consider removing that.
I don't understand why he wouldn't have a natural death. It feels as if you're switching the machine off, you're killing him.
I understand.
And he's not yet dead.
Okay. I understand how that can seem. However, what we've got to think about is really to what level is he currently alive. The consultants have done a series of tests which have shown that although the machine is inflating his lungs for him, his brain is to all intents dead already. He's not making any response to the sort of stimuluses that we would expect him to respond to if his brain was still functioning.
It's just too much to take in and decide.
Okay.
I suppose, yes, if everybody thinks it's best, that's what will happen, but it's just so sudden.
No, I know. And these things always are. There's one further issue that we need to consider in this situation, which is that although we don't expect your husband is going to survive this, and in fact we do believe that his brain is it is dead. There is a question of whether he's able to help anyone else at the moment, and by that I mean the possibility of organ donation. Now, is that something that you or he had ever discussed?
No, we hadn't, but I can see why you want to switch his machine off and why there's so much rush about it.
Okay, well,
I mean, he keeps saying that, in fact you said it 2 or 3 times, that it's unlikely he'll survive. Now that suggests there's a chance he might.
Okay.
You haven't said he definitely won't. And if you were sitting here in my position, you would have a lot of doubts about this.
Okay. Perhaps that was a poor choice of words on my part initially.
Well, no, you've just said it a minute or 2 ago as well again.
Okay. I think the most important thing here is that his brain is dead, and all that's happening is that the machine is keeping him seemingly alive. However, there is no chance of him recovering from this. What I don't want to do is, you've mentioned that this seems rushed, and I appreciate that everything has happened in the space of a very short time for you. However, what I don't want to do is to rush you into any form of decision. I've mentioned organ donation because many people will have strong feelings about this. Now, did he ever have a donor card or anything like that?
No.
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 And do you have any views on donation? Do you understand what we mean by this?
Yes, I understand. I just don't want his body messed around. I want him intact when we bury him.
Okay.
But more than that, I mean, I could change my mind on that, but there is no way I can take on board switching off my husband's machine and effectively, whatever you've said, killing him, and in the same breath consider organ donation. So you're probably going to have to keep him on the machine whilst I think about it. I can't just do the 2 things at once.
I understand, and these are 2 immense decisions that you're being asked to consider. I think the 2 things that I would say is that, firstly, there's a huge amount of information to take in, and we have specialist teams. Organ donation is a complex issue, and to understand the process I think is important before you can make that decision. So whilst I'm not asking you to make any form of decision now, would it be alright if we got in touch with them and asked them to provide you with some more detailed information so you can understand things better?
But you're not going to take John off the machine whilst I make that decision.
No.
I do need a couple of days to think about it.
Okay.
He's not against, I mean, I don't know if he's for or against organ donation. It's just something that's not come up, but I can't make that sort of decision this afternoon.
That's fine. You're not being asked to. Do you have any family members that you'd want to either discuss it with or give them the opportunity to speak to us and ask
Our
questions?
children are quite young now. I couldn't discuss it with them. I might get in touch with my sister and discuss it with her.
Thanks very much, Dr. Ritchie.
Thank you.
That was very good. Could you just talk me through some of the issues you discussed with Mrs. Thompson just then?
Okay. Well, this is a very complex issue. Her husband has collapsed with a life-ending cerebral hemorrhage. The key issues for discussion were the fact that this was a end-of-life scenario from which he was not going to recover, and there were no viable treatment options. And the second question was introducing organ donation and the possibility of whether that was an option. in their minds.
Okay. And how did you think the interaction went?
I think it was a challenging scenario. The initial amount of information that his wife seemed to have was more limited than perhaps I expected. And I think there was a long period spent discussing his medical state rather than moving into the issue of an end-of-life scenario and the need to address organ donation.
Is there anything with hindsight that you could have done to have perhaps moved the conversation along a little bit more fruitfully?
I think perhaps a greater emphasis to be placed earlier on the fact that he was in fact brain dead, and therefore everything else was sort of almost a moot issue in terms of treatment.
Yeah. Okay. So if you were to do it again, what would you have changed the language you used, or?
I think in an early setting, I think I would have avoided the words deteriorating, nothing we can do, and just established the fact that he was brain dead almost from the outset.
Okay. And just in terms of you talked a little bit about options and treatments and things like that. Do you, in hindsight, do you think that helped the conversation along? You were talking about surgery being the only option.
I think perhaps that could have been made clearer that at his presentation, surgery was the only viable option for maintaining life, but at that point it was not an option. It was not deemed appropriate by the neurosurgeons,
Right, yes.
and as a consequence, he is not going to survive. And in fact, at this point, he is essentially brain dead.
Okay. I think it's probably important to think about ethics in this sort of a situation. Would you mind just briefly telling me about the medical ethical principles and how they relate to this particular scenario?
Okay. Well, the first principle is autonomy. Now, clearly, in this position, this man is not able to currently make an autonomous decision. However, he may have expressed his wishes, which one would wish to respect. He and his wife had never discussed this, and to her knowledge, he did not carry an organ donor card. We could have explored this further with an advance directive, but I think that addresses the issue of autonomy. In terms of beneficence and non-maleficence, in relation to the patient, you don't want to artificially sustain him when there is no hope of a recovery. You would certainly be potentially doing him harm by not acting in his best interests and subjecting him to interventions that have no hope of benefiting him. The main principle that pertains to this situation is justice. Whilst this man is not going to survive, there is the opportunity that through organ donation he may help others. So I think that is the key principle that guides this, but you also have to keep reflecting on the autonomy.
Okay, thank you. Very good. I thought the encounter started very well. I think you showed a lot of empathy. You confirmed the identity of the person before sort of launching into quite an intense conversation with the wrong person. That's vital to do. You then gave a pause when you'd given what you felt to be some bad news. Unfortunately, she jumped to a completely different assumption, and when you were saying that surgery would not be done because the neurosurgeon didn't feel there was anything they could do, she then made the assumption that he was going to improve without surgery. And I think that was the first sign that perhaps she had perhaps strayed a little away from where you were hoping she would be in terms of her understanding.
Indeed.
I think it's with these situations it's easy to be confusing because we use gentle language, we use a lot of euphemism, and I think the key lesson here is to avoid euphemisms and to be as blunt and direct, which eventually you were. But I think by then she felt almost like you were trying to change the past, change what you'd said, in much the way a sort of a politician might sort of try and worm out of something that Paxman's made them say. So I think it's much easier to run that scenario when you've been firm and blunt in the first place than to try and backtrack
build up
afterwards.
to it, yeah.
But then you did establish that she wasn't understanding you. You tried to sort of remedy the situation, and using unequivocal terms, not going to survive this, natural death not possible, brainstem death. These are all important things that she needs to hear, really, and then you can get on to organ donation. Organ donation itself, very difficult situation. A lot of hospitals would say that untrained individuals shouldn't be tackling this on their own and should leave it to the organ donation team. But clearly, this scenario insists that you do go through that. So we have done our best there. But I think the confusion led to a little bit of a loss of rapport between yourself and the patient, and I think towards the end she didn't really trust you, and I think that would then make the possibility that you were going to harvest her husband's organs seem quite a scary and macabre outcome. So, but otherwise, I thought you did very well.
Thank you.
Okay. So the main thrust of this scenario is actually twofold. Number one, it's delivering bad news, telling a woman that her husband is essentially terminally ill. And to do that, we need to use unequivocal language. We need to, when someone is dead, we say dead. We don't say passed on. We don't say that they've gone to a better place. We leave as little confusion as possible. And the second thrust is persuasion. And unfortunately, in order to persuade her that organ donation is necessary and ultimately beneficial to the general public, we need to have delivered the bad news effectively.